Obviously, the COVID-19 pandemic is still with us, right? And, we're once again coming into the fall, winter season. And so we're starting to see a resurgence of different variants, kind of an alphabet soup of variants, if you will, in Europe, which can often be a bellwether for what we can expect here in the US. And we're starting to see increased positivity, upwards of 20% in certain parts of New York City, for example. So although we've been at a lower point, maybe in a better situation than we've been in quite some time here in the US, we acknowledge that there's still, challenges for patients with lung cancer, and they remain susceptible to breakthrough infections. And so I'm part of a large NCI-funded study being led by Dr. Fred Hirsch and Dr. Adolfo Garcia Sastre at Mount Sinai. And what we're finding is we've been studying the immune response to COVID vaccination in patients with lung cancer. And we've recently started analyzing patients who have breakthrough infections. And what we're finding is that our early data suggests that patients with lung cancer can still experience rather severe breakthrough infections. And so, we want to encourage patients who are vulnerable to continue to take appropriate precautions. That, includes making sure you're up to date on vaccinations. We just had the bivalent booster rollout here in the US, which offers protection against the original strain as well as the Omicron strain that really, that dealt us a big blow last winter. So, get that vaccination, continue to use masks in crowded settings on public transportation, wash hands. And, I would say masking can also help reduce exposure to flu and other respiratory viruses that are circulating really heavily right now. We're seeing a significant upswing in flu activity here in the US. So, continuing to take those precautions, I do think we're maybe at a better place than we've ever been in the pandemic because we have vaccines, we have, monoclonal antibodies, we have treatments, which is better than we were 3 years ago when this first started. But it's still a risk to certain individuals, and we encourage them to make responsible choices and to protect themselves, especially as we move forward toward the holiday season and in the fall and winter.